resistant tuberculosis. If nothing is done, antimicrobial resistance could cause 10 million deaths each year by 2050. In addition, 24 million people could be forced into extreme poverty, and most of them will be from low and middle income countries. Alerted to this crisis, the May 2015 World Health Assembly adopted a global action plan on antimicrobial resistance, with its first strategic objective being the improvement of awareness and understanding of antimicrobial resistance through effective communication, education, and training. The Global Action Plan was endorsed by FAO and OIE. Antimicrobial resistance is made worse by misuse and abuse of antibiotics in humans and farm animals. The COVID-19 pandemic has exacerbated this problem. Recent studies suggest that 72% of hospitalized COVID-19 patients have received antimicrobials, but only 8% had infections that can be treated with these medicines. AFRO has been supporting its 47 member states to develop, implement, and monitor national action plans aligned with the Global Action Plan in collaboration with partners. 38 countries have developed their national action plans under One Health approach, and 27 are today approved by national authorities. Congratulations, countries. 30 countries are enrolled into global AMR surveillance system, commonly called GLASS, and GLASS promotes and supports a standardized approach to the collection, analysis, and sharing of AMR data at a global level by encouraging and facilitating the establishment of national AMR surveillance systems that are capable of monitoring AMR trends and produce reliable and comparable data. 10 African countries have established national antimicrobial consumption surveillance systems, and 3 countries have updated their essential medicine list to include the Access Watch Reserve categorization, which helps to classify antibiotics toward ensuring optimal use. At WHO, we are currently working with countries to strengthen One Health integrated surveillance across the human health, food chain, in environmental sectors, and to establish national stewardship policies and programs to optimize the use of antimicrobials. In partnership with the Food and Agriculture Organization of the United Nations, FAO, the World Organization for Animal Health, OIE, Africa CDC, the African Union Inter-African Bureau for Animal Resources, and the UN Environmental Programme, UNEP, we organized in November 2020 the African continent's second joint campaign and first virtual campaign for World Antimicrobial Awareness Week, which was a great success. FAO, OIE, and WHO has been monitoring implementation of the Global Action Plan. The 4th annual tripartite AMR country self-assessment 2019-2020 revealed that the African region showed progress in conducting national AMR awareness campaigns that targets all relevant stakeholders. However, additional technical support will be needed to establish baseline information, monitor progress over 2 to 5 years, and ultimately work towards changing behaviors among key stakeholders. In addition to awareness, the tripartite assessment reports show that the vast majority of the countries have begun to include AMR in some pre-service and in-service training for health workers nationwide. This is a positive trend that needs to be further strengthened so that all relevant healthcare workers are provided training on AMR. Looking forward, this training should be provided to healthcare workers in the public and private sectors and needs to be systematically and formally incorporated into the curriculum for pre-service trainings. The engagement of relevant national educational authorities and professional associations will be essential for the progress. Ladies and gentlemen, dear students, awareness, education are just some examples of how you can contribute to prevent and control AMR, but there are many opportunities for contributions with promoting surveillance, research, infection prevention control, WASH, rational use of antimicrobials, etc. Progress has been made, but there are still a lot of issues to address AMR as an important component to achieve sustainable development goals and global health security. As clearly stated by the organizers, young people are an important and valuable stakeholders in addressing the global health threat of AMR, since they are the next generation of public health professionals, the potential future antimicrobial prescribers, users, stewards, and policymakers in the professional practice. WHO has extensive and wide-ranging resources on AMR that could be useful for the work ahead of you. Please feel free to visit our website, as well as our AMR campaign website, and to reach out to us for any technical assistance. As you start this antimicrobial resistance leaders program for tertiary students in Africa, we welcome you to journey with us on this challenging but worthy undertaking fight against AMR. Once again, I thank the organizers and best wishes to students who have committed themselves for 5 months of intensive work to lead change in Africa towards a world free from the fear of untreatable infections. Thank you. Merci beaucoup. Asante sana.
Thank you so much, Dr. Letitia, for those inspiring words. And indeed, WHO actually has a wealth of resources, and we are being encouraged to visit the website. Thank you. Now we can see you. So our next speaker, just to say that if you have any questions from the attendees, please feel free to put these in the Q&A. We might not be able to address them in this forum today, but as the program goes on, we'll make sure that all concerns are addressed. If it means getting back to the speakers, we'll do so. So our next speaker is Dr. Irene Kuba and she's from FAO, and she's actually the regional AMR project coordinator and AMR focal person for Sub-Saharan Africa. And Dr. Irene has supported us in a lot of initiatives that we have done as React Africa, and it's a pleasure to have you here as you offer some insights from FAO perspective. So over to you, Dr. Irene.
Yes, thank you very much, Julian, and good morning. At least from my end is good morning. Good morning, everyone. It is my pleasure to be here. I have lectured and done research for about 20 years before joining FAO. So I'm very happy to be here again with students so that we can interact and see what we can do for AMR. Let me try to share my screen. Julian, please let me know if you can see my screen.
Yes, we can. Please go ahead. Thank you.
Can you see my screen? Okay, all right. All right then. So I would first like to start by discussing briefly what AMR is, although I may understand that many of us may know what it is. But what I would like to emphasize already, what antimicrobials are, they are just substances that are able to kill and inhibit the growth of microbes. So, and usually people are still discussing about antibiotics, while antibiotics are just of antimicrobial. And we have AMR, that means the resistance to antimicrobial. When the substances, drugs have been developed to kill and inhibit some microorganisms, and for some reason they manage to develop a strategy that can actually inhibit those antimicrobials in such a way that they don't work. This is the way AMR occurs. Some microorganisms may have a natural resistance to antimicrobial. AMR, really, we are not really talking about those ones. It's only about the microorganism that was able to develop a resistance strategy to the antimicrobial produced to tackle them. So we have the antibacterial, which are the antibiotics used to treat diseases caused by bacteria, also antivirals against the viruses, antifungal against fungi, antiparasitic against parasites. It's very important that we have this knowledge because when we are actually advocating for AMR, people can see that according to the different drugs, we have different type of resistances. And AMR can occur naturally or can be acquired, but usually is mainly enhanced by human action, misuse, overuse, counterfeit drug, and so on. And then, of course, the consequences: reduced therapeutic option, prolonged heat sicknesses, and many people have died due to AMR. And of course, we will have a physical and economical burden on family, the healthcare system, and then the government. So because AMR occur in different sectors, then we need a One Health approach to tackle it. And at African level, we have a quite strong collaboration between the African Union, the tripartite FAO, WHO, OIE, UNEP, as well, of course, the civil society, academia, and research, so that we can discuss together and try to find a solution for to control AMR. And we have been doing different activities together. So what are FAO goal and vision on AMR? Is to reduce AMR level and slow the emergence and spread of resistance across the food chain and for all food and agriculture sector, preserve the ability to treat infection with effective and safe antimicrobial to sustain food and agriculture production. So by doing that, FAO and partners will better protect food system, livelihood, and economy from the destabilizing effect of AMR. So to support the global action plan, developed by OIE with the support of FAO, developed by WHO with the support of FAO and OIE, FAO have also developed a food and agricultural sector. So the first, although it's over, most of the area of this action plan that involve first awareness, and second, we have surveillance and monitoring. The third focus area will be on governance, and then for promoting good practices in the food and agriculture sector. Because one thing is to tell, for example, farmers not to use antimicrobial, for example, for growth promotion. Another thing is to give them alternative. So we also recently developed a new action plan for 2021 to 2025, still the same four focus area, but we added another one to really emphasize on promoting responsible use to keep antimicrobial working. So example of activity under the different focus area, for example, of awareness, we have awareness and advocacy campaign, and students have supported a lot in different activity we have done in country. For example, for surveillance, we do training, research, collection. For governance, we are involved in national action plan development, legislation, One Health platform setting. And for good practices, we help at farm level for biosecurity, vaccination, good hygienic and management practices, and so on. So what have we done to support academic and research activity? We think that AMR knowledge should be increased through research and teaching. And FAO have supported various activity, for example, developing an online AMR curriculum at global level. This is actually ongoing, supporting the Faculty of Medicine and Pharmacy in Senegal for having a postgraduate diploma on AMR. Also recently in Guinea, we supported the development of curriculum on AMR and AMU in the vet school, and a research activity has been done on antimicrobial residue in fish in Senegal. And in Burkina Faso, we concluded lately a project with the university in Bobo-Dioulasso to support identify the vector and reservoir in the spread across different sectors of infectious diseases caused by resistant microorganisms. And we encourage academia to integrate lecture, module, courses in the curricula, and also encourage research on AMR in student research projects. Personally, I had several PhD students, and I always manage that in their research project, they will have at least one chapter on AMR. And some of those students who are now also lecturers are doing the same with their own students. So it's also a way to help really address the issue. So what can students do really to help with AMR? Well, I think that students play a determinant role in AMR mitigation. For example, on the short-term basis, all these awareness and advocacy campaigns, they have already played a huge role. For example, for the regional African World Antimicrobial Awareness Week 2019 and 2020, they helped a lot. At national level, usually when you want to fund a help country develop activity, for the Antimicrobial Awareness Week, they will always think about students first. And in long term, we think that because students will become one day professional, they will be able to support implementation of measures that will support appropriate antimicrobial usage and mitigation of AMR. Now, as a lecturer, when there is a problem, very rarely I will come with the solution to the student, because students are very bright and they can come up with very excellent idea. So I will ask the question to the audience, from the knowledge you have, what do you think you can do to help with AMR control? So I think you can think about that, and during the session, you can share with us. And I think from that, we can discuss, and hopefully the organizer will be able to use also what you have proposed to come up with a good strategy. And last, we have developed a survey at FAO level to try to assess the knowledge of academia and research on AMR, so that we can really improve our strategy in mitigating AMR. One of my colleagues online will share a link later, and I will be grateful if you can complete the survey so that you can help us help everybody. So Julian, I think roughly is what I wanted to say, and I may join back later, but if there's any question, I would be happy to answer. Thank you very much, and over to you.
Thank you so much, Dr. Irene, for that very insightful presentation. And I'm sure the students, you have actually learned something from distinguishing the antibiotics and antimicrobial, and also the work that you have been doing in academic research, which is very good. And I have seen quite a number of opportunities there that the students can actually follow up on, including the survey you've just mentioned at the end. I'll invite our next speaker, Dr. Chandia Awanas. She's actually the Regional One Health Coordinator at the World Organization for Animal Health, OIE, Africa. She's a public health professional with over 20 years experience in health emergency preparedness, and she's also working on supporting the One Health initiatives on the continent, including AMR, Rift Valley fever, Ebola, and other emerging and re-emerging endemic zoonotic diseases. So I think when I did my presentation, I did say there were quite a number of veterinary students that are with us today there that have also joined in the program. So I think they'll find the work that OIE is actually doing quite interesting. So over to you, Dr. Chandia.
Thank you very much. Thank you, Julian and Merfin, for inviting us to this important launch of the program for the leadership program for students. I will share my screen, and please let me know if you can see it. Just 1 minute.
Yes, we can see it. Dr. Chandya, please go ahead.
And it's now in full presentation mode?
No, not yet.
Now?
Not yet. We can see, we don't see the slideshow yet.
Okay, let me try one more time. I'm not sure what's happening. Okay.
Yeah, perfect. Please go ahead. Thank you.
Okay, thank you very much. As Julian said, my name is Shadia Wanous, and I'm the Regional One Health Officer for OIE based in Nairobi, Kenya, covering the Africa region. So my presentation will be on the OIE strategy on antimicrobial resistant and the prudent use of antimicrobials. As Irene said, our strategy is aligned with the 2019 Global Action Plan on AMR. And it has the same 4 key objectives that Irene showed us for the FAO action plan as well. The first one is about improving awareness and understanding. And the second, it's about how to strengthen knowledge through surveillance and research. And the third, it's about how to support good governance and capacity building. And the fourth one is about how to encourage the implementation of the international standards regarding AMR. This strategy was launched in November of 2016 after we had 2 resolutions from our assembly on the need to work together to tackle the AMR issue. And now, for this strategy, the main tools that we use to achieve the strategy, it's about how to implement the standards and guidelines. It's about our AMR or antimicrobial use database, and it's about advocacy through the communication and advocacy materials. But this is all underpinned by the quality of our vet services and their ability to address the AMR issue through legislation, through education and training, and also through the collaboration with other sectors at the country level and at regional and all levels, including human health and environmental health. Now to the first strategy, it's about improving awareness and how we are doing this and increasing the understanding of the extent of the problem and how it can be handled. We do a lot of targeted communication and advocacy materials. We reach out to our vet services and the paraprofessionals to encourage to have a professional culture that support the responsible use of antimicrobials in animals. We do this through our workshops, conferences, and symposium, and a lot of awareness raising done in collaboration with FAO and WHO to ensure that we are taking the One Health approach to address AMR. Now, how to strengthen our knowledge? We do this through the surveillance. As I said, we have the antimicrobial use database where we collect data from all the countries on how they use antimicrobial agents in the food producing and companion animals. And we do an analysis and we share annual report on this use. We also have our World Animal Health Information System, or what they call WAHIS. And through this information system, we collect information on animal disease status in general, but also on antimicrobial use in animals. We guide and support research into alternatives to antibiotics, including, for example, how to use vaccinations in animals to reduce the need to use antibiotics in them. And of course, we encourage public-private partnerships in research and risk management. Now, the third action under the strategy, it's to support governance and capacity building. And for governance, we support countries to develop and implement their national action plans, promoting the One Health approach. We also help them to do risk assessment initiatives to understand the magnitude of the problem and identify areas where they can focus their national plans. We also help to develop and modernize the legislations that govern the manufacturing, the market authorization, importations, distribution, and use of vet products. We do a lot of training for our focal points on vet products that they oversee the AMR in countries. And we do a lot of training to our vets, but also to the para-professionals who are at the forefront of the national and regional activities. This is just an example for the core curriculums and the guidelines and recommendations for the competencies that the graduate vet should have to assure that we have quality national vet services. And this second one, I should have another one similar on para-professionals. Now to the last one, last action on encouraging the implementation of OIE standards. As an international organization, we are a standard setting organization mainly. And we do this through developing codes and manuals and guidelines to support countries to implement their activities. And for this one, first, I would like to highlight our list of antimicrobials of vet importance. And we train our vets on how to ensure that this list is kept functional through the responsible use and the ethical use of these important drugs. We do a lot also through to advance the animal sectors through comprehensive framework of quality science-based standards. And in this, we collaborate with our tripartite colleagues in WHO and FAO. So for the standards, I will not go into details, but just to show you that in the terrestrial standards, we have a lot of chapters that deal with antimicrobial resistance. And also in the aquatic standards and manuals, we have a lot of chapters that address antimicrobial resistance. I encourage you to check those standards and guidelines through the link that I provided here. Now to an important issue that we support our countries to do, it's how to assess their performance of the vet services at the country level through this tool, what we call the BVS. And we have 45 critical competencies that we assess, including for the AMR. And in this tool, we have indicators on the diagnosis, on the prescriptions of drugs, and on the treatments of animals. And all this information contribute to help us develop capacity building specific activities targeting to the need and the gaps identified through these tools. Now, we also have a vet legislative support programs. As I mentioned, we support countries to either review update or develop new legislations that govern the use of antimicrobials in animals. Now, the last thing I would like to share with you is about our specific country projects under the Multi-Partner Trust Fund. And we mainly help countries to promote the use of vaccine as an alternative to the use of antibiotics in animals. We also help the countries to develop biosecurity standards to prevent diseases from emerging at the farm levels and contaminating the environment or preventing the disease from entering the farm in the first place. We do a lot of supply chain mapping for vet medicines, including the cross-border trade and the trade in illegal or falsified and substandard medicines. So in summary, this is summarize our work with our vet services in countries to help achieve the 4 key objectives under the OIE strategy for the prudent and the responsible use of antimicrobial resistance. Now, what's the role of students in AMR? For us, we see students as ambassadors to the countries, to the organization working on this. First and foremost, they should be a role model. So they will take an action. They will use antibiotics responsibly, and they will dispose of them responsibly also. We see the students as advocates through their social media channels or through their networks with other students and disciplines and at different levels, not just at the university level or the school levels. We hope that you will help us with the celebration upcoming in November for the World Antimicrobial Day. And we are planning to have a student competitions on photos explaining the context of antimicrobial resistance in the region. And we hope that we will have a lot of submissions from you on this call. This program is an example of how the leadership for antimicrobial resistance can be achieved by targeting a future generation. So in conclusion, I would like just to highlight that we need to take a One Health approach where all sectors should be involved in the addressing the problem and all disciplines as well. And OIE, of course, is committed to support the country process to build and implement the National Action Plan to combat AMR, especially in animals. So thank you very much. I hope I give a quick overview of our work and happy to take questions. And if you would like to send email also, please feel free. Thank you so much, Julian.
Thank you, Dr. Chandia, for that very informative presentation where we actually we understood more about the key objectives that you're doing in the animal sector. And I'm sure the students are being challenged as these presentations are going on, that you are the role models, you are the advocates, and a lot of opportunities that I'm seeing as the presentations are going on of a lot of work that students can actually leverage on. And so please, thank you so much, and kindly share the link that you had said you will in the chat. I'll move over now to Dr. Yewande from Africa CDC. So Dr. Yewande Alimi is actually the AMR and One Health Program Coordinator at the Africa Centers for Disease Control and Prevention, the Africa CDC. This is a public health agency for the African Union. And Dr. Wande is very passionate about involving multi-stakeholders in the region. And we have actually collaborated before in quite a number of interventions where we're targeting various stakeholders. So over to you, Dr. Wande, to share your reflections. Thank you.
Thank you very much, and good afternoon to you all. Congratulations to the students that have been selected. I'm sure that you are all delighted, and I would like to say to you that the previous speakers who are my colleagues are easily the best voices you can hear speak about AMR. So you must be grateful to the React Africa team who have pulled together the best of the best experts to share with you today. And we hope that all of these things that we are sharing with you around the work we are doing will be relevant and to the work and your interest, because really, as many of my colleagues have said, you are indeed the future of controlling antimicrobial resistance on the continent. So I will be talking a bit about the work that Africa CDC leads, which in case you don't know where Africa CDC sits, it sits in the Africa Union Commission. It is a technical agency of the African Union. And I will not try to repeat what other experts have said. Indeed, AMR is an urgent threat, not just to health, but to security as well as our economic growth as a continent. And as much as AMR is, or antimicrobials are something that humans use, animals as well as environments have a role to play, and that's why we really need to start looking towards fully embracing a One Health approach. So in terms of our work as Africa Union, just to highlight our strategic document, which is the Africa Union Framework for Antimicrobial Resistance Control, we have setting underlying principles. We know that we need to learn more around what AMR burden is or antimicrobial consumption is on our continent. But we always say at the African Union that we know enough to act now. We need to embrace a One Health approach by involving human, animal, plant, and environment agencies. Policy and advocacy are very important, but we must not forget that technology and driving high-level political advocacy, as well as engaging civil society organizations, are equally important to the work that we are doing. So when Gillian invited me, she wanted me to focus a bit about the work that we do at Africa CDC, but most importantly, to leave you with opportunities or areas where I would encourage you to look into, because that's where we would really like to engage more the younger generation and youth, particularly students at this moment. So our document really has 4 primary goals, which is around improving surveillance of AMR organisms among humans, animals, and plants, delaying emergence of AMR pathogens, limiting transmission, as well as mitigating harm among patients already infected with AMR organisms. The activities that we really we adopt to ensure that we are able to implement our framework is ensuring that we are advocating for policies, laws, not just a quick fix approach, but to enable long-term prevention and control of AMR, engaging civil society organizations as well as youth groups, but most importantly, also building human resources for AMR surveillance and control. So in my next few slides, I'll just be showcasing some of the things that we are doing. Because we are seated at the African Union level, we have really been driving high-level political advocacy. One of the things I'd like to highlight, for example, is the African Union's heads of state and government recently endorsed the African Common Position on Antimicrobial Resistance, as well as the framework which I presented in my previous slides. Now, for your understanding, this is the highest level of political endorsement that has been done as a continent and together as a continent. So it's particularly unique to note that at this point, we have that political backing that can lead us to actually start implementing some of these activities. My colleagues have talked about the collaborations between the AUC, that's the African Union Commission, as well as the tripartite organization, as well as UNEP. And last year in November, we had our directors sign a joint communique detailing some of the work that we will be doing together as organizations to control AMR on the continent. It's also good to note that we already have an existing coordinating mechanism as a continent, and that's the Africa Coordinating Group with REX, as well as WHO, FAO, OIE, and our colleagues at AU-IBA. So one of the things we are really keen about is many times is the layman doesn't really understand what we are saying around what AMR is. So we know that we need foot soldiers, we need champions on the field to help us make the messaging easier to understand. All of the technical things that we are saying. What does the lady that sells meat or fish in the market, or what does the farmer really understand when we say AMR? And this is where you and other groups would play a unique role, is making this this highly technical messaging easy to understand so that we can drive behavior change. As part of the work that we have been doing with REACT, for example, like Julia mentioned, is around training civil society groups on how to message AMR and how to drive behavior change and how to lead country level campaigns. About last year and about 2 years ago, we rolled out an online course for AMR, particularly for students and also member states representatives, so that we get more people to understand the relevance of AMR. Along with our African Union Youth Division, we had a spotlight session last year, looking at the role of emerging AMR leaders in Africa. And this is really important because these are the voices that will take AMR forward. And this is something that we are looking to do along with our AU Youth Division on how we can continue to build capacity for youth groups, for youth organizations, for young professionals on how to champion AMR. And my colleagues have talked about a lot of work that we are doing, not just as Africa CDC as an institution, but our approach is to do together, because we cannot really win the battle against AMR alone. So some of the work that we have done is things around the World Antimicrobial Awareness Week. Last year, we had a full-on virtual session, which was really exciting. And we had sort of specific sessions for students and young professionals. But I think it's worthy to note that how we have evolved. If you see the bottom where you can see us all standing, this was sometime in Nairobi in 2019 when we had the first one, the first Africa-specific World Antimicrobial Awareness Week in Nairobi. And now we've moved to the level of fully engaging our regional directors, high level, pushing AMR to the highest level of our regional directors. My colleague Chadi has already mentioned the unique role. For example, we sometimes run Twitter campaigns, which I know that many, Daniel was a part of last year. And so these are the things that we want to see. How can we start to put the messaging on social media? How can we put our voices on social media? Your generation is very tech savvy, is very social media conversant. How can we put the message such that it is very interesting? Anyone wants to understand what AMR is. We at Africa CDC have the antibiotic guardian page, which we have been using for to drive stewardship campaigns, which is also unique, where people take pledges and commit to handling antibiotics better, passing on the messages around driving behavior change. With a group of pharmacy, the professional body for pharmacy, we joined them last year and early this year to run some mentorship programs, which is something that we at Africa CDC are keen to continue around driving mentorship for young professionals as well as students. One of the other things I think I really would like to encourage many of you to think about is research. We want to start seeing research that is able to drive policy, looking at around driving domestic financing. What we want to see is research for Africa, led by Africa, where we can leverage on global partnerships. Our approach is to identify a problem, understand the problem, intervene and drive sustainable interventions. The unique edge of our research is really that we are at the AU, so we will be able to champion evidence-driven policies across our member states. So I think, and I see Julian, I don't know if I still have a few minutes, but it's really for you to think around how can the work that you are doing at your level, things like research, things like qualitative studies, CAP studies, things like cost-benefit analysis, how young Africans can start to think around driving AMR research, because really you are the future of AMR. And I'm hoping that as the years come, we will continue to work with you. And I hope that this session has really opened up and you understand better what roles you can do in the AMR space. So over to you, Gillian.
Thank you so much, Dr. Wande, for that very rich and insightful presentation. I'm sure the students are being challenged as the experts go through these presentations. Indeed, evidence-driven policies, way to go. And with the appreciation that the work that's being done by the African Union and how they can inform policy, I think through this program, we should be able to see more research around AMR coming through. So we were supposed to also hear from UNEP, but our speaker was in a meeting that was clashing with this one. So anyway, as the program goes on, we intend to have a lot of sessions that focus on using the One Health approach. So we'll definitely touch on that as well. And as I mentioned in the beginning, any questions that you have, my co-moderator Daniel is actually monitoring the chat and taking them down so that even if they are not addressed today, we can be able to address them as we go, looking at all the other opportunities that are there, including the other online courses that we have been told about from the different speakers. So at this juncture, I now hand over to my director, Dr. Mefin Mpundu, to officially launch the program. So Dr. Mpundu is the director for REACT Africa and is also the Africa Partnerships and Stakeholder Engagement Lead for the International Center for AMR Solutions, ICAS. And Dr. Mefin is also an honorary research fellow at the University of KwaZulu-Natal, South Africa, and also a chair, co-chair for the External Advisory Board of the Newton AMR Drug Discovery Program. So over to you, Dr. Mefin, to officially launch the program for us. Thank you.
Thank you so much, Julian, and thank you so much to all the panelists who have done an excellent work in presenting the work that they are doing around AMR, who have also challenged the youth students in taking up this role. That a few of you, I mean, out of the many applicants that we looked at, those that responded, we were able to select a few to be our inaugural students in the program that we are working on. So I will, I'll go ahead and just share my screen. I've got a few slides that I'll just run through, and I certainly look forward to really further engagement. All the partners that we work with, the intergovernmental organizations, I'm so grateful that you were able to join us, the RECs. To each one of you, we owe you a lot. And of course, all the participants that have joined us around the world, we are very grateful that you've been able to join us in this inauguration of the AMR Leaders Programs for Tertiary Students in Africa. when you look at REACT, and we have 4 major objectives that we look at. One of them is the support of the development of national action plans. The other one is where we focus on research and development. Then we also have actually a focus on movement building. And with movement building, our focus is to engage the whole of society, because antimicrobial resistance, as the previous speakers have said, is not something that can be addressed by one patient, 2 patients, 1 or 2 groups. It will take actually a community level, a wide community engagement to actually address antimicrobial resistance. And actually, to this end, we really focus on strengthening the existence coalitions. We actually extend the work towards like civil society organizations in African countries that have not been involved in antimicrobial resistance. For example, those that work in the food industry, that work in HIV and AIDS, in malaria, and in other areas. And so we actually work with them to be able to build their capacity, interest them in AMR, and that they would contribute in their countries with capacity buildings, again, extending the coalition, engaging the government, and holding our governments also responsible to the regional and the global pledges that they commit to. And so we know that really LIMCs have certain challenges that are peculiar, and we have a number of challenges that are unique to us. But nevertheless, I think we have seen that the other global challenges and regional challenges that we have had, when we have engaged the whole of society, when civil society has been very active, when the government has provided leadership, we have been able to make many strides. We look at actually immunizations, for example. We look at the HIV and AIDS. We've managed to move forward, but we are not moving at a greater pace with antimicrobial resistance, which is one area we need to actually focus on. So why did we even envision and start working with students? We've been working with students from a primary school level up to graduate school. And for us, it was really essential that students are really a pillar. They are the cornerstone. They are the ones that can drive and sustain the change. If they get the concepts of AMR much earlier, they will have an influence over their lifetime, and that influence will be able to slow and contribute to the mitigation of antimicrobial resistance. And so we consider you students as valuable stakeholders in really addressing global health challenges, such as AMR. And if we can engage you much earlier, your energy, your vigor, you are able to use that and channel it in a positive way and engage the policymakers and also the professional practices. They are key. We need to catch our future leaders at the right age if we are to win this fight against antimicrobial resistance. This slide, this has been actually discussed, that really in responding to AMR, we need a multi-sectoral, a One Health approach that engages professionals and students and partners in the human health, in the food industry, in the planetary industry in terms of plants and crops, environment, and also in the terrestrial and aquatic animals. And I think it's very important that, some of the recommendations that came out of the interagency coordinating group on AMR, really, they touch on students. When we're looking at really accelerating the progress in countries, students are a key component. Innovation, to secure the future, we, research and really coming up with tools that are very innovative. Communication that breaks down AMR, that, anybody can understand it. We're collaborating with more effective action. really, these are areas, again, where really students can actually be able to make a challenge. And we know that if we don't address antimicrobial resistance, there are a number of sustainable development goals that will be affected directly, which we will not be able to achieve by 2030. And there are some that, that will be affected indirectly. So the AMR global health threat really requires a multi-sectoral approach that is quite clear, leaving no one behind. I'm very encouraged personally to see the level of effort that have been shown by students in terms of a number of activities they have performed, because we've been engaging students for the last actually 5 years or so, and we've been actually growing in this sort of engagement with them, and would like to create champions among students ultimately that will affect society and the progress that we go through. This slide just shows some of the work that we've been doing in engaging students and other stakeholders. Last year, we had a number of webinars, 15 online webinars, and we also launched a community of practice that brings together, working with Africa CDC, like Dr. Ewande had mentioned much earlier, where we actually engage various actually CSOs, and some of the civil society organizations that we engage are actually students. And so really creating and growing this platform of engagement has been quite key for us. But also we have been, challenging and engaging with other organizations that focus on areas that touch on antimicrobial resistance. For example, the UICC, that's the Union for International Cancer Control. We've been working with them. We sit on the task force and have been making a lot of contributions, because without having really active antibiotics, we will be unable to treat actually cancer. So we need effective antibiotics to be part of that. We've also been, engaging in the World Antibiotic Week, Real Awareness Week, Antimicrobial Awareness Week, which was changed last year, to engage a lot of new actors, a lot of organizations, and really cutting across issues around gender. And one area where students have also been active has been in the area of innovation. We have a program that we run every day that is called really Innovate for AMR. And this is where we challenge a student to work in teams and come up with brilliant ideas and brilliant innovations on addressing antimicrobial resistance. We have seen innovations from the students, that come up from, how we can be able to generate and gather data, how we can be able to disseminate data, how we can strengthen, the supply chain of antibiotics and track the movement towards actually coming up with actually really solutions that are embedded in the technology that we have now. We are in a world of technology now, and that is quite key. So I hope you recognize your name on this slide, and these are the names of the inaugural group of this leadership program that we now are launching today. And like I said, if you see your name there, you should be very proud, and you should really applaud yourself, and also count yourself not just lucky, but that you have the responsibility now to bear, because our program is meant to actually build a lot of capacity in you, a lot of trust, a lot of faith in you, and that you'll be an emissary, you'll be a champion in your university, in your faculty, in your community, and you'll be able to actually contribute to the solution in addressing antimicrobial resistance. And so with that, it is my honor and pleasure to actually go back and really, really congratulate you as the inaugural team of AMR Leaders Program for tertiary students in Africa. Program. We hope that this program is going to grow over the years, and we will engage all the partners that gave presentations earlier on, and we really hope that the future of preserving our antimicrobials lies with you as professionals and leaders of tomorrow. So it's my great honor and pleasure to launch this program and to say really congratulations that you are in this inaugural team that will really fly and really make a difference, not only in your universities, in your communities, but beyond the borders, beyond the frontiers that we have. So congratulations, and wishing you the very best. Be in touch with us. I will share all the extended curriculum with you and what we are going to do. Again, congratulations. In Swahili, they say ongera sana, and so all the best. I'm so very proud of this team, and really proud of the mentors that will lead you in this program. So having said that, again, congratulations and wishing you the very best. Thank you so much.
Thank you so much, Dr. Murphy, and congratulations to all the students. I'll hand over now to Daniel, who's one of the students, a very motivated young student who is currently in his 4th year at the Jomo Kenyatta University of Agriculture and Technology, and he'll give a vote of thanks. Over to you, Daniel.
Thank you so much, Julian. Good afternoon and good evening to us all. Yeah, so as has been introduced, my name is Daniel, and it's really wonderful to have you all, you know, as we start off the program, as we learn from each other. And it is my hope that whatever we learn during this session, we may translate it into efforts in our own individual way, based on your priorities and interests, so at least we should all do something to mitigate the threat of AMR. So I would love to thank our guests today for availing themselves despite their busy schedules. Dr. Letitia, Dr. Chadia, Dr. Iwande, Dr. Tracy, Dr. Murphy, and and Julian, and all of you too for making it to the session, and also Dr. Irene in absentia. And it has been really great listening to our speakers. On my end, I've really learned a lot, and I hope whatever small that you have learned, and we'll get to put it into action. What I would love to say, what has really captured my mind is, I think we all are in a position to act. So don't just learn and keep the information to yourself, learn and inform others, and also try and do something. Yeah, so thank you so much to our guests for making it. Thank you for the wonderful presentations. Thank you for your time. We really do appreciate, and we hope that we'll get to engage you through the program. We'll always be knocking at your doors, seeking for counsel, seeking for advice, so at least we know how to become better professionals in the future. Thank you. And also love to thank the REACT team for helping organize the program, and also my fellow students as Students Against Poverty Africa. And I hope with this program, we'll get to have many more young AMR stewards. Thank you so much, everyone, and have a wonderful afternoon. Thank you. Over to you, Julian. And apologies, I wasn't able to share my video, but I hope you can see me through my passport. My network is a bit shaky. Thank you.
Thank you, Daniel. Yes, thank you for those remarks, thanking our speakers. So at this juncture, we can excuse the keynote speakers and experts that joined us earlier today, as we move on to the second part of the agenda, which will be the induction. We'll have an induction session that will be opened by Dr. Tracy from React Africa, who will give insights on the online course that will open the program, and also will share the activities that they will do for the coming 5 months. So we really, I think, have all been challenged, as the previous speakers have said, and I think according to whatever interest you have as students, I think you'll be able to see what you can actually help to do as the future leaders in the continent. So thank you so much once again. And to the speakers, we'll definitely be engaging you as the program goes on. If we need anything from you regarding questions that can come from the students, and any technical support that we might need, will definitely be liaising with you. And thank you. Quite a number of links have been shared via the chat. So I think, I know we are capturing all those, and for students, please kindly visit those as well. So thank you so much, and we can excuse you as we move on to the next session.
Thank you. Bye-bye.
Bye. Thank you so much. So we'll take a break as we complete a short questionnaire that will be delivered via Mentimeter for the students. So the next presentation will start in the next 10 minutes. But as we take our break, we can just also complete the Mentimeter questionnaire. I'll share in the chat the questionnaire that we are supposed to do. And I think there have been quite a number of questions regarding whether the presentations will be shared. Yes, we will share the presentations, because I think they were quite rich with a lot of information and relevant links that can be helpful. So the presentations will be shared, just responding to that concern. So we can take a short 10-minute break as we complete the Mentimeter questionnaire. The link will be there in the chat, so that we can start by reviewing whatever will have come out from there. Yeah, I've just shared the link for the Mentimeter in the chat. You can go to that link, put the code, or alternatively just click on the link in the chat to complete it. It's good to see representation from different countries here. We've got Uganda, Zimbabwe, Nigeria, Tanzania, Kenya, quite a number of students joining in from different countries, which is good. I think we have 5 more minutes to this interlude before I invite the next speaker. Wow, it's interesting to see that this is really a true multi-faculty group. I see quite a number of different faculties there. We've got pharmacy students, laboratory, I see MPH, dental, and I think we are going to learn a lot through the cross-learning. And the format of most of our, of course, this webinar, since it was ceremonial, we use the webinar platform where really you are just the panelists are the ones speaking. But going forward, it will be more interactive so that we can learn from each other. Yeah, lack of awareness, definitely agree there. It looks like that's the most, what most of you actually think. I see ignorance, I see lack of sensitization, inadequate knowledge. So I think as the future leaders now, we are actually seeing what is actually driving this problem. If we increase the awareness and knowledge in the region, I'm sure it will go a long way, even in terms of things that are there, like self-prescription that I see coming, this illiteracy as well. How do we break down this problem of AMR to make it more relatable to the common public? This is the key challenge. So I think lack of awareness is coming through as a very, very key thing that is driving this problem in Africa. And I'm glad the students agree, because in most of the forums that we do, this is the key challenge that actually comes through: the ignorance, lack of awareness. And it's interesting to see that that's what most of you have also put in there. All right, so now the last slide is just talking about your main expectation for this program. And I see to gain knowledge and skills, devise means to reduce AMR through sensitization, further knowledge and research, expecting to learn more, that's good. Gain more experiences and sensitization, be equipped to fight AMR, to learn more about the extent of AMR in Africa, to learn how a student can contribute in curbing AMR. So we hope by the time we are ending this program, some of these expectations, if not all, will have been met. There is also one expectation to collaborate in projects on AMR. I think this can actually come to being a reality. And looking at the various work that the expert presenters that were before us have just highlighted, I'm sure based on whatever interests you, you'll definitely find something that you can collaborate on, something that you can research on. There's a very big lack of data in Africa, and sometimes coming up with evidence-driven policies is a challenge. So we hope from this group, we can be able to have quite a lot of research that can help in influencing evidence-based decisions and also policies. So thank you so much for completing this. And at this juncture, I would want to hand over to my colleague, Dr. Tracy Muraya, who's the policy advisor for REACT Africa. Over to you, Dr. Tracy. So Dr. Tracy will just talk to us about the online course before Daniel then sheds more light on the program and the timelines. Sorry, Dr. Tracy, over to you.
Hello, everyone. Please confirm you can hear me. Julian, I hope I can be heard.
Yes, we
Okay,
can hear
great.
you, Dr.
Yeah,
Tracy.
we can hear you.
Okay, thank you. Hello, everyone, once again. It's a pleasure to be here, and thank you for even your patience being with us right from the beginning. And of course, having gained quite a bit from the high-level speakers. So mine is to take you through the program before Daniel comes in to deliberate a bit more on the timelines. So just give me a minute to share my screen. But at least from the Mentimeter, we've seen that majority of us are hoping that from this program, we will be able to actually be empowered so that we are the expert leaders of tomorrow. Just a minute. That are actually championing AMR in the continent as a whole. And not only that, that we are the ones that are going ahead to actually bring about a generational change out of the ignorance and the lack of awareness of AMR. If there's something also that has come clearly from the expectations of this program, even as it was being designed, is the fact that we cannot deny the fact that yes, AMR should be approached from a multi-stakeholder approach, but we cannot deny the fact that students are actually a very key stakeholder in this agenda, AMR agenda. And so we need them, we need you as you come into being the next, medical professionals, public health professionals, and in whatever other area. As Julian mentioned, she was saying or rather telling us of the different cadres that actually overwhelmingly registered for this course. It was not just from a scientific background or a health science background, we also saw engineers coming in. And we do know that as much as we did not get a presentation from our counterparts at UNEP, we are aware that the environment also plays a very key role when it comes to actually the spread of AMR, and hence also needs to be contained. So even people like engineers who need to be cognizant of the fact that we need, for example, better outlet systems, that our waters, the water that we're drinking is not contaminated per se, there's a filter system of some sort, then we need such people. So I will just go on to the background. And as you've had most of the morning, obviously we are in this dilemma at the moment because of the grave underuse, misuse and overuse of antibiotics, not only in human health, but across the animal sector, agriculture sector, and even the environment. So hence the reason we have an issue with AMR. Unfortunately, we really do not have new antibiotics coming in. Yes, we have our global leaders at the WHO and their counterparts up there trying to brainstorm, calling upon think tanks to see how best we can now replenish this pipeline of new effective antibiotics, but from a place that benefits both the manufacturer and even the population at large. And it's not an easy task, but it's ongoing. And we even now have lists labeled as, the critical, or rather the high priority list that needs to address the critical infections that we have out there. And so such antibiotics need to come into play now, and need to be accessible, available, and affordable. So while WHO has reported that antibiotic resistance has become a global health crisis, we've heard from the presentations in the morning that antibiotic resistance, yes, it's a pandemic, just like COVID-19, for example. But while COVID-19 comes with its own ravaging effects, and it's very out there and in our face, AMR is quite in the background. While still, it's in the background and being aggravated by the ongoing dynamic COVID-19, for example, which has led to increased use and inappropriate, if I may say, of antibiotics. I would bet almost the balance in my bank account right now that each and every person right here has witnessed, or at least has heard, of the misuse of azithromycin in the current and ongoing pandemic. So maybe we need to do research going forward on in our little or in our ecosystems within us. Is azithromycin actually now effectively tackling the infections it should, or are we in a new crisis of resistance to the chemical azithromycin itself per se? Others have actually even gone ahead to compare AMR. If you compare it with ravaging pandemics like COVID or Ebola, AMR is a pandemic that can be compared, for example, to when you have a lobster and you've put it in water, and the water is just, it's you haven't put the water on heat yet. It's just there in the pan, and the lobster is, just quiet and just, observing the environment until the heat comes on and it's boiling. And so the lobster, unfortunately, if you've seen how lobsters are cooked, they are actually boiled while, quite alive. And so it's just a ravaging scenario. So, friends, the situation requires immediate action. And we all need to share the responsibility of preserving antibiotics for current and future generations. And this is why students are even of more importance, because you're the future leaders and you're the future professionals of tomorrow. Antibiotics are actually likened to the fire extinguishers that we have in our medical profession or in the medicine fraternity. Well, we really need them for a surety of safety, right? They sit there, and until they are needed, it's only when we think of using them. However, will this fire extinguisher actually have any form in it to effectively quell out the fire? So the cost, sorry, apologies. So the course will be a course that, or rather will consist of 6 topics, or 6 modules. And each module should ideally take about 4 hours of your time to complete. Should you do this, you should be able to complete it within a month or so. As Julian mentioned, it will take on a hybrid nature. While it's self-paced, some are in form of a webinar, others are from just self-paced, and you take now the 4 modules will be self-paced, so you take them at your own time, and then we have the webinar part of it. So the course was revamped in 2021, and while it had always been there, or rather Uppsala University and REACT were able to partner also with EIT Health Network, also based in Europe, to bring about a revamped program which contains new video lectures, quizzes, study questions and assignments, reflections, so that they're able to also enhance just the learning process and enable us to self-evaluate, to really see whether we've acquired the knowledge that we need to gain. At the end of it, it means that we'll be able to understand not only how antibiotics are developed or how they work, but also the urgent need for innovation, because we are running out of a very precious resource, and the dilemma on how to simultaneously address what we find, especially in our setup in the resource-constrained society, where we not only have issues with accessing quality and affordable antibiotics, but then we also have the flip side of where, because of weak regulatory systems, we also have easy access, and then which rather comes down to excessive use and inappropriate use in our settings. So the course objectives are 5. The course should help you understand antibiotic resistance and how to go ahead and take action from your various sectors and your various expertise. It will help you learn about the mechanisms behind the emergence and spread of antibiotic-resistant bacteria. Go through real-life stories, not only told by patients, but also the medical professionals and other experts as they have tackled antimicrobial resistance in their field. It will enable us to understand challenges and the control mechanisms that we can apply to prevent and limit the impact of antibiotic resistance. And lastly, we'll be able to introduce us to tools that enable us to further understand how antibiotic resistance unfolds, how best we can manage it, control it, and even just prevent it at all levels that we may be at. So the topics are 6. The first one being the discovery and history of antibiotics. Next one, the importance of antibiotics and consequences of emerging resistance. Then we have basic mechanisms of how antibiotics work and their relation to bacteria, whether they kill them or make them dormant. And unfortunately then, how antibiotic resistance develops. Unfortunately, resistance to any antibiotic actually develops as soon as it comes into the market, when it starts being used, meaning that stewardship and management and proper use of these antibiotics is quite key. The third topic, major challenges related to resistance in clinical practice, innovation, the financial models that need to be applied there, and equal distribution of medicines. Financial models are actually something that's really giving the international space huge challenges, because as I mentioned before, yes, we need the antibiotics, but at the same time, the pharmaceutical industries need to also see what comes back to them, how they gain, right? So it needs to be a balanced model that enables them to make their profits, yes, but at the same time, have effective antibiotics that are out there. Then the fifth topic, actions that can be implemented on a societal, clinical, or individual level to manage, control, and prevent emergence and spread of resistance. And finally, global initiatives to meet this global health threat. So at the end of it all, you should be able to tackle and engage in activities that are needed to effectively address the threat of antibiotic resistance. And this does really call for us to handle antimicrobials in which antibiotics are contained with absolute care. It is our responsibility going forward to actually even make the grandmother back at the homestead to understand why she cannot get the red and blue, or rather red and black capsule, amoxicillin, and just use 3 of them, right? As opposed to using the entire course. So this is a busy slide, but I'll just maybe dwell on part 1, which shows you the course outline and how it will be, or how it is designed. So you are welcome to the course, you meet the course team, and of course you have a few definitions. And then taken through the different topics. Discovery of antibiotics as mentioned, the burden of ABR, then a few warm-up exercises, then tackle on, has Fleming's warning really been ignored? He warned us about resistance to penicillin setting in years ago, decades ago. But of course, this, we can see what has happened right now. And then of course, experiences from the field, antibiotic resistance in the media. At REACT, we do engage journalists. And you could have seen also, not only just from REACT, but world over, or even in your local settings, a few journalists here and there actually talking about antibiotic resistance. And then the course enables you to test your understanding through a simple test, as well as an assignment to actually reflect and analyze on different topics in this case, importance of surveillance in part 1. In the other parts, you see that there are different reflection exercises, but the reflection exercises are actually meant to help you just tackle the assignment from an analytical point of view, going forward. And then that's the end of part 1. And go through right through to the fourth module, I apologize, which the fourth module presents the global perspective of things. And this module is actually a showstopper, if I may call it that, because it really pokes your brain and teases your thinking. Where will we be in future now that you've learned all this? What are you going to do as an individual or as a network? And where will we see ourselves? Will we actually have antibiotics and antimicrobials that are enabling us to live in a world that we are actually free from fear of untreatable diseases, infectious diseases rather. That is just an outline, or rather a backdrop of how it will appear as you log into the course. The link is right there at the bottom. And so it's an easy, what do you call, module, not module, but easy program to actually handle. And it just helps you to, the different links, you're able to go to them one by one. Thank you.
Thank you so much, Dr. Tracy, for that wonderful presentation, for taking us through. It has been very insightful. Dr. Tracy, I love how you break down things, break down in terms that we are able to understand. Thank you so much for the presentation. I would love to share my screen. For me, I'll just share the program outline so that we get to see what we'll be doing, how is the whole program organized. And as Dr. Tracy has shared, we will start off with the AMR short course. So let me know once my screen starts sharing kindly.
We don't see it yet.
Okay, thank you. Just a minute, please. Okay, not yet. Can you see it now or not yet?
Not yet.
Oh. Okay, sorry for that. Let me try resharing once more. I hope it's now visible.
Almost.
Just a minute. Yeah, so I'll just take us through the program. It's more of award table. So once more, welcome so much to the session. I hope it's visible. Maybe Julian or Dr. Tracy.
Yes, we can see it now.
Okay, thank you. So yeah, I'll take us through the program. As it has been shared, it will be more of a hybrid program. So majorly we'll engage, self-paced learning. We'll also have interactive learning. You'll see that in the program, we have so much of group discussions, student presentations, sharing of reflections. Yeah, and it will also engage we'll also have some experiential learning where now as a students will get to develop some solutions or come up with some models on how to tackle AMR. So as has been shared, today was the launch ceremony that was on 16th of July. And we are currently at the induction session. So after I finish taking us through the program, Julian will take us through some of the key guidelines of how we shall operate and the means of communication and some more details. So from tomorrow to Thursday, that will be on 22nd July. What I'll do, I'll just take us through the program basically, but I'll share the program in our communication channel, which will be Slack for your acquainting and also constant review so that you know what you are supposed to do at maybe which time. Yeah. So we'll have some, we'll kind of be meeting after maybe once per week or once per fortnight, depending on the structure of what we are doing at that moment. The sessions are organized in terms of months. We have month 1, we have month 2, we have month 3, month 4, and month 5. So for the first month, the first week, will just be acquainting with the short course that has been shared. And also we'll have a baseline survey that we'll share with you via the Slack channel. So that's what we'll be doing. We'll get to, you know, learn more about maybe what you want to learn and also see how we can also improve the program. So that's what we'll be doing for week 1. And then after that, we'll have a meeting next Friday. So we'll have we'll share a brief outline of the course, and this will be student driven. Different students will show you how we'll do it. You will get to share your reflections, what you have been able to see through the course. And this is just part 1 of the course, or maybe a general overview of the whole course. And the reason for this discussion is for us maybe to brainstorm and see how we may learn more from the course and also how we may apply some of the things that we learned from the course. So after that, then we'll have a 2-month remote learning that is self-paced for you to finish the course. Then we'll share, we'll have a small task where each one of us will get to write a reflection on the course learnings. We'll share it via Slack too. And the reason for writing the reflections is just more like an assessment, getting to, you know, see what struck out different for you. What do you hope to do after learning the session, maybe which areas in the course really interested you. And then after that, we'll have a session, and this will be the final discussion for the course. And then we'll have 2 of the students share more about the course, and we'll have a way of selecting, maybe the students will be leading the discussions, and this will be majorly through country selection. And what you have to share, you can either share maybe a presentation, or you can also maybe create a presentation or maybe a video, something, just whatever way you think is best to share your learnings. So I've broken down what we are to do for month 1 so that at least we all have an idea of how the sessions will run. So for month 2, month 3, month 4, and month 5, I won't really go down into the maybe break it down so much to the details. So I'll just maybe share briefly about each session. So for month 2, we'll be focusing more on national action plans and One Health approach. So we'll have several sessions. We'll get several experts, especially national focal points from different countries, to share more about the both the national action plans, and then we'll study them. Also, we'll get to learn the reasons why we have the action plans. I will know something about policy making, and also how the implementation going on, the challenges so far, and how students can take part. So, and also we'll have a discussion around the One Health approach, and this will be in context of the national action plans. At this juncture, then students will be required to share some presentations, and this will be from what you'll have learned from the previous sessions, and we'll have guests moderating the session. So after that, we'll have a short session, short group task, sorry. And in the group task, we'll learn more about antimicrobial stewardship in human and also animal health. So how we'll be creating the groups won't be more of having definite groups. I would love each one of you to interact. Maybe today, at least by the end of the course, you have interacted with different students from different countries, and not just maybe a small cluster. So we'll be organizing the group sessions randomly using Zoom breakout rooms. So for example, if today we have had a discussion and we have a small group task that we are supposed to do, we'll just feed the information through Zoom. Then Zoom will group us into breakout sessions. Then we'll have a short session. We'll get to a point before the session ends, and then you can then share your contacts and everything. Then it will be upon the students to take initiative and maybe create a group or discuss on how you will engage in the task offered, and then prepare a small presentation or summary about the learnings, and then share during the next meeting. So most of these group sessions will take maybe 1 week or 2 weeks. Yeah. So that's for month 2. We'll majorly engage on national action plans and looking at AMR from a One Health context. And then we'll have something on antimicrobial stewardship in human and animal health. And this will be more deep, especially for human into clinical setting, and now for the animal health, more into the husbandry part of it. So that's about month 2. So month 3, then I will start around 10th of September, as you can see. And for month 3, what we'll focus on majorly will be on leadership, and also research, policy, design thinking, and systems thinking. So the first session that we'll have, the first webinar session, we'll have 2 guests. One of the guests will take us through personal competencies, how things on time management, communication, work ethic, branding, and all that. We'll also do a bit of studying, and this will be remote, self-paced on leadership. We'll share some resources, then you can get to understand on the different theories of leadership and also followership, and get to maybe reflect on yourself, analyze yourself, and see where you fit best and how you may utilize this in maybe AMR initiatives. Yeah, and we'll also have a session on leadership competencies, and this will be more of educating us a bit on the organization structures, maybe how to develop a small initiative, what do you need to consider maybe if you want to come up with a club or something. Yeah. Then for session 2, we'll have more on research. We'll have a session on research and social accountability. As had been shared before, it's good that we engage in research, but engage purposefully. That is, So we'll kind of connect research and social accountability. How do you do research that is maybe beneficial to the community? And we'll also have a session on policy to see how we may use this research to inform policies. We'll also be taught a bit on maybe drafting policy papers. Then the third session for the month and the last session for that month, we'll talk more about innovations, design thinking, and also actualization of systems thinking in community projects. We'll have two experienced speakers too, who have done more really engaged in design thinking and systems thinking. It may be a new concept for some of us, but we'll see how to actually, utilize this in developing sustainable solutions for AMR. Then at the end of month 3, we'll have a short mid-program monitoring and evaluation. So we'll kind of share some reflection essays. We'll also have a survey, and we'll also have a few video recordings and podcasts for some students to share their what they have learned so far. Yeah, and yeah, that's it. And also we'll document these reflections and maybe share them out and also share them with you in case maybe you would require to refer them later. Yeah. So for month 4, it will be more on experiential learning from there. We'll have less of webinar sessions and less of discussion sessions. So for the first phase of it, the first session, the first webinar session or the first training session, we'll get to learn more about project planning and development, monitoring and evaluation, and all that. Then, since it will be around October, then we'll be starting preparations for the War Week. It will be good. I will introduce something on how each one of us will be required to participate during the War Week, especially maybe designing a short individual project. But basically for month 4, after the first training session, we won't have any other session. Now students will be required to design a good content-specific, good sustainable solution model that you think maybe can help maybe generate solutions for an AMR. Doesn't have to be aligned towards a certain area, but we'll share more details about that. So we'll work in groups, and each group will be required to submit a proposal or a model. Then some of the proposals that will seem feasible, some of them will be funded during the next year, that's 2022. Then that's basically what we'll do during month 4. It will be more of interactive engagement, getting to ideate, getting to engage with your team. And at the end of it all, it will be good if each team has developed a good model. Then, as I've shared, some of the models which maybe will be ranked the most feasible or the best to implement, then will be funded the following year. Then for month 5, then we'll now develop, each one of us, or maybe in a small group, something realistic, something that we can do during the World Antimicrobial Awareness Week. So during the World Antimicrobial Awareness Week, each one of us will be required to take part in a small project. So the first 3 will be awarded, and then we'll also share experiences and reflections, how it was for you, maybe actually implementing, maybe it was a social media campaign, if maybe you engaged maybe a community somewhere, or maybe you engaged your fellow students. So we'll get to share more. And also it will be a learning point for us, getting now to have some hands-on training. And I think from that, then we'll have learned more, and it will also be an opportunity for us to apply what we'll have learned throughout the 5-month course. So that's it. We'll then have the program review, and then we'll have a closing and awarding ceremony. And then some of the speakers that were present today will also be present. So we envision that we'll have the ceremony around 10th of December. And it's during this ceremony that we'll then have the certificates. We'll have a few students, 2 students share about the experience in the program. And also we'll have some awards, maybe for some of the best individual work projects. And then we'll also unveil the projects that will be funded for 2022. I know it's quite a lot to take in for now. So what we'll do, we'll be breaking it down for you. So we'll focus on monthly sessions because each month has its own theme. So as we start every month, and the month it's not aligning with the calendar month that we know about, but each of the key learning concepts that we have included in the program will take around a month. So we'll share more details. We'll also share the program through the Slack channel. Julian will talk more about that. We'll be using Slack for communication, and we'll have different channels to share the learnings and resources for every month. Yeah, so I'm sure we have some questions. Please type them in the chat box. I can also see some of us had raised their hands. So let me just stop sharing so that at least I'm able to answer to some of the questions. Yeah. Yeah, maybe were there questions? Maybe anyone with a question about the program breakdown, please feel free to share as we continue. And also, yeah, we will share the schedule. And as I invite Julian, we'll also share the Slack and the WhatsApp channel link for communication. But Julian will talk more about that. So that's it. And I'm sure that we'll get to engage more. Thank you.
Thank you so much, Daniel. And I know the program looks like it's a lot of things to digest at this point, but don't worry, that will be shared. I think there were quite a number of concerns regarding whether the program will be shared, that will be shared. And before I move over to the last session of today, I'm just launching a very small poll with 2 questions on the screen now. If you can just react to it and just answer the 2 questions that are there so that we can just get a feel. Daniel mentioned that we'll be having some periodic webinar sessions. So we just want to see when your time preference will be to have this, so that at least it helps us in the planning so that we know which dates might work best for the sessions. So just give it about 3 minutes so that you can just complete these 2 sessions and we see. These 2 questions, sorry. All right, so yeah, it looks like Saturday is the most preferred time slot according to the results that I'm seeing here. And also the majority of people have not used Slack before, but anyway, I'll shed more light on that one as I do the next presentation and the final one for the day. All right, so. All right, please confirm whether you can see my screen.
Yeah, it's visible,
Yes.
Julia.
Good, great. So I'll just take a few minutes to go through this. I'll just give a few expectations and ground rules for the program, and then talk about the communication channels that we'll use, part of the M&D that we'll do, and then we'll end with a Q&A session, where if you've got a question that has not been addressed on the chat and maybe there's something you'd want to ask, we'll give you an opportunity to do so in a few minutes. So I think Daniel has mentioned that this program is going on for 5 months. And as I said, the program might seem, of course, you'll get to understand more as the months go by, and as we share the program, and feel free to respond. So there will be some self-paced sessions. Dr. Tracy did a good job to give an overview of the online course that we need to do in the first month. We'll have that as self-paced, but then we'll also have the interactive sessions or the webinar sessions that will happen in between that. And we have put 80% as this percentage for attendance for these sessions, because we'll now be monitoring which students are attending and all. In the event that there is a problem or there's a reason for not attending, kindly also reach out so that we'll be able to be aware, because commitment is one of the things that I think would be good to do as we get into the program, so that at least we can have this going on well. So the requirements for this is really yourself, really, and not much. The COVID-19 pandemic, I think, has led to most of us doing virtual classes. So my assumption is that most of us already have devices that they use for attending the virtual classes for academic purposes. So we intend to also use a lot of this. Obviously, this will be a virtual program, so the expectation is to have this and also internet connectivity. So one other thing regarding this program is we are very open to it being very participatory. Feel free to reach out. I'm encouraged by the lot of suggestions coming in the chat, even for this first session. So keep those coming through. And I'll just give a rundown quickly of some ground rules. I talked about the attendance of 80% to the online sessions, and also a key expectation as well is the participation. This is a shared learning environment. We are different people from different faculties as the students, and it will be good for us to participate as much as possible so that we create a shared learning environment and experience. If for any reason you are facing any glitches, especially for the communication channels and anything else, please reach out to myself or Daniel. Then when we are contributing anything, say in the write-ups of whatever that we are doing, it's also important to cite our sources in whatever things that we'll be doing. Be brief as well. We don't want to be preachy and say a lot of things, but try and stay on point. That is helpful when you're articulating something and to facilitate learning amongst your fellow students that will also be in this program. Then criticism must be constructive, well-meaning, and well-articulated. it's very good to have criticism that is constructive and not one that actually makes someone feel bad. Because in the process of interacting, some people can be overbearing or say something that can make a person not feel good. So that should also be taken into account. And be patient, you know, in these communication channels, sometimes there's a lot of repetition. If you read what someone else has already posted or alluded to, instead of creating a lot of repetitive messaging, sometimes it's good to read what's before, and maybe whatever you want to ask has already been addressed up. We are a diverse group, as you clearly saw. We received applications from different countries. So it's good to respect this multicultural environment and also be respectful of the diversity that is within us. And finally, in terms of language, we shouldn't use language that's offensive or any comments that are either racist, sexist, or jokes that are unacceptable or touch on personal things like religious beliefs or disability, age, etc. I'm sure you get the point in all this. And if you feel there are some rules that we should add on, please feel free. As I said, we want this to be as participatory as possible, since this is an adult group and we are also learning. I'm learning, looking forward to a lot of learning. Everyone is learning, and so it would be good to, even the experts themselves will actually learn from this. Daniel alluded to the fact that we'll have quite a number of guests coming in to give presentations here and there. So feel free to reach out, sorry. So the communication channels that we'll use are mainly three. The first one is Slack. I'll talk about Slack quite a bit because when I went through the poll results showed that more than half of the students haven't used Slack before. Email would be another communication channel that we'll use, but I think we can avoid using this unless there's something that you need to communicate that doesn't need to go to the Slack channel. Maybe it's not for the group or it can go through a direct message. But you realize why I'm saying it's better to use Slack, because it's easier to monitor messaging on Slack as opposed to email. Then thirdly, we'll have a WhatsApp group. At the end of this presentation, before the session concludes, Daniel will share a link for us to join that group, and then we'll use it. Although the WhatsApp group, here I had said we use it strictly for reminders of deadlines or events or something that's urgent that needs to be communicated. From the chat, I realized that quite a number of students were keen on having the WhatsApp group, but you will notice that Slack also, again, makes it easier to organize our discussion, organize whatever links we are sharing. Like today, you saw we got quite a number of links, which if we then put in the Slack channel as the links that were shared during the launch, we can further break down to say what maybe OIE shared or what WHO shared. It's easier for you to refer back to that, as opposed to a lot of maybe WhatsApp messages that when you're looking for something, sometimes it's a bit difficult to find. So it's good, we'll have a WhatsApp group, but I think it would be good to use it for communication that is urgent or for announcements for something that will be ongoing, maybe the next day or any sessions that are ongoing. So what is Slack? Slack is just simply a messaging app that's used by many organizations to connect their people or to connect teams to the information they need. I have shared the link there. The good part with dealing with your generation and most tertiary level students, the current ones, is that you are very tech savvy. I think one of the speakers mentioned that. So I think you'll catch up very fast on this Slack. It's quite an easy tool to use. And the first step actually would be to download the app for this Slack. That is the link that I have just shared there. We can also share this via the link, or you Google this Slack. And if you download the app, it actually has a mobile app and also desktop version. So you can use it on your laptop. You can also use it on your mobile device, depending on what you prefer. Like if it's for something that you just need quick updates on, I think the mobile device can suffice for that. So the Slack workspace that we have is called the AMR Readers Program for Tertiary Students Africa. It's very similar to the name of this program. And the invite link will be sent for you to join. The link is also there below. So you can just join this Slack channel via the link. But first of all, I'll sort of elaborate more on what how Slack looks like, what it is. The interface that you see, it's quite a simple thing, as I told you. It might look like it's difficult to work with, but it's very simple once you log in and you have downloaded this app. So the interface will look more like this. You have the name of the program there. What is key to know, the language for Slack, workspace. Workspace means the name of the program, the name of the workspace that you are creating, the one that will collaborate on. In this case, the AMR Leaders Program. Within that, there are different channels. Channels now, can I call them headings of how we are organizing our communication? Because Slack allows you to organize communication based on different topics. So I've actually taken a snapshot of how the channel looks like now, where we've got different headings there. If you go down, you'll see like the individual project planning. That's what's coming there at the start. But this is just for, suppose we are sharing, Daniel alluded to the fact that at the end, we will ask you to come up with some ideas. I know you already shared some essays of what you think you can do. These will be awarded into projects that can be done moving on to next year. So anything that's relevant to that, say we want to communicate a template to use, or what are the, say, how do you write your concept notes? What template are we using? What, or if there are questions or discussions relating to that, you'll find it in that channel. Then you'll have a general. The general channel is just for communication. That's general. That's not really, we can have things then moving on to the different sub channels down there, but the general communication channel will be the main one that looks at, that's the general communication. Say we are saying today, Daniel said we are going to put a link to a baseline survey that needs to be done. If you log into Slack, you'll see in the general channel that maybe there's communication that says, please fill in this baseline via this link, etc. Dr. Tracy talked about the short course that we'll do, the one we'll do in the first month. Any communication regarding that course will then go, say, for the AMR short course. So if you go there, you'll be able to see whatever postings, including maybe the presentation she did, including the discussions that we are doing. If we are going to have 2 students that are going to maybe present on what they have learned or etc., you'll find that there. In the subsequent months, we'll have different topics like One Health, national action plans, anything that's relevant today, you'll see it there. Currently in the national action plans, if you go, we have actually put national action plans for quite a number of countries for you to go and peruse and just see. Because with some of the sessions we had, it was interesting to see that some of the students did not even have an idea whether they had the national action plan in their country. So it would be also good to just have a feel and see what is there. So my next slide will just mention that, you know, when you go online, there are so many guides, tutorials on YouTube, on the Slack website that teach you how to go about using Slack. Although, as I said, it is a very simple tool. I just put in there to say when you log in, you'll see a place that says profile. And this is something that you can easily do. Create your profile. If you prefer, you put your image and you talk about which institution you are from, because it's very good for interaction to know who we are dealing with. I've talked about the fact that in Slack, you can send messages. You can send messages either to the common channel or you can send direct messages to people. At this juncture, I'll just play a video, very short, it's 1 minute. Yeah, just under 2 minutes, I think. That just gives an overview of Slack so that what I've just been saying sort of like comes to light. And after this session, you can then, of course, you do your own personal tutorial or share. So this is one of the sites that is helpful for when you want to just get started using Slack. What do I do for your profile? That's why I say there are so many resources that can actually tell you about this mobile messaging, this communication tool that helps to organize our communication. So I'll quickly play this.
Welcome to Slack, a channel-based messaging platform. Let's take a quick tour, starting with the sidebar. You can use a...
Sorry, can I get a confirmation whether you can hear?
Julian, I think the slide has not yet transitioned.
Okay.
Yeah, you can try. We can hear the sound, but I think that the video is not visible.
Oh, okay. You're still seeing my presentation. You're not
Yeah.
seeing the.
Yeah.
All right. Let me just reshare. All right, Daniel.
It's now visible.
To access the channels you choose to follow and see your messaging platform. Let's take a quick tour, starting with the sidebar. You can use the sidebar to access the channels you choose to follow and see your direct messages. When a channel name is bold, it means you have unread messages in it. When you see a badge, someone has mentioned you and needs your attention. And when you want to write messages for any conversation, you can use the Compose button. Next, let's see what's happening in this channel, which is a dedicated space for a social media project. You can see the number of people in this channel. To find out who, you could click here. The team has been sending messages and sharing files in this channel. They've also added one-click responses to messages with emoji reactions. For example, Lisa added the checkmark reaction to let Harry and the team know she was done reviewing this file. Now, let's take a look at the variety of messaging options you have when working in Slack. You can bold text, add lists, and loop in teammates by mentioning them to get their attention. You can also attach files so that they stay together with the rest of the conversation. And unlike email, you can edit or delete a message you've already sent. Great for typos. And there you have it, a quick start guide to Slack. If you need help or more information about Slack, you can find it here.
All right, so that was just a summary of how, just a brief overview of how Slack works. And as I said, you can then further do some looking at the self tutorials as you go on. So regarding M&D, we mentioned about a baseline assessment we'll do. As part of the program as well, we'll have a midterm assessment just to check in and see what we need to improve. You know, it's always good to do that because maybe things have been planned from the end of React Africa and Students Against Superbugs, but you are feeling that if we change this way, it might make sense and what. So we really appreciate any feedback, and we'll have a midterm assessment where you'll be able to also give your insights. At the end, we'll have an end-line assessment. We also intend to have an external review because this project is supposed to be, it's a pilot where we see how best we can improve in the subsequent interventions in the following years and all. So the last bullet is just saying continuous feedback and monitoring. That is very key. All the comments that come in, like this session, we are recording it, and we'll continue to record even the other sessions. Whatever feedback you are giving and insights can further improve this program and also make all the interventions that we'll be doing with students very relevant and also impactful. So that brings us to the end of what we wanted to discuss. Daniel is going to share the link to join a WhatsApp group. So feel free to join that group via the link that will be shared in the chat, and we'll continue communicating Initially, we'll communicate both through email and also the Slack channel so that we are just on the same page. And in our next session, we'll also check in and see whether everyone has been able to use Slack, whether you need any other support, and in between, you can also reach out. So regarding the questions, I don't know, Daniel, whether there are any questions that are coming in from the chat that might need responding. And also, if there is someone who has a question, feel free to raise your hand. We can allow you to speak at this juncture so that we can, it's a good opportunity to hear your voices as well. Yeah. Are there any questions from the chat, Daniel, that need to be addressed? Or from the Q&A tab?
Yeah, I think we have Prosper asking whether we concluded on the online sessions. I think we reviewed Julian and get back to them, but we saw that the most of the attendance was, most students preferred Saturday. But I think we review and get back to you. Yeah.
Okay, yeah, it looks like the final results show that it's on a 50% that say prefer on Saturday. So what is majority? We don't rig the elections as what happens in Africa. Anyway, I think majority inclining to Saturday morning. That's what I'm seeing. 9 a.m. to 11 a.m. EAT is what the majority is saying, followed by, I think Friday and Wednesday are almost at par, although Friday is the next acceptable one there. And we do have, one or two votes, which is 100% of the vote that is speaking to that. So the results are here. I don't know whether, is my screen visible?
Yeah, it's visible, Julian. Yeah, I think around 54% say Saturday morning, 9 a.m. to 11 a.m. Fridays, 29%, 3 p.m. to 5 p.m. and Wednesday, 23%, making a total of 100. So I think the majority prefers Saturday, Saturday morning.
Yes.
Yeah, but I think we also have to be quite a bit flexible, Julian, because of the guests.
Yes, one of the discussions we had when we were trying to organize how to do this program was the challenge sometimes of having speakers come on a Saturday. But now that we will be interacting via Slack, via WhatsApp, we can just see how we plan and try and be as flexible as possible, because even the times that we are now are a bit challenging with COVID-19. And we also appreciate the fact that you are students, you've got your own school going on, the exams and all the other things that are also demanding. So yeah, we'll try and see how best to be flexible. Daniel, I totally agree. Because sometimes we might have a speaker who prefers coming on the Friday, during the Friday session. But what is key is you'll be informed well in advance so that at least you are aware of what timings are happening. But most probably either Friday or Saturday morning for the sessions. They are not so many, but they are there. Maybe it will be like a session per month or so that requires your attending. Yeah. It's session maximum 2 for every month. So when those happen, we'll communicate well in advance. Is there any other question?
Yeah. Thank you, Julian, for that. I can see we have a question on, someone is asking whether, how would maybe a friend join the program? Maybe Julian, you can address that. And maybe Saddam, before Julian addresses the question, maybe you can elaborate on what you mean by the data resources. And we also have someone asking to be sent the links via Slack, via email, and you have logged in as using your mobile device, so we cannot be able to identify you. So please check your Zoom settings and relog in using your name. Yeah. So Julian, the question is on how can maybe friends join the program, or is it fenced? Yeah.
Oh, the question is, sorry, Daniel, just repeat. It's saying how do what? Friends join. Sorry.
Yeah. Someone is asking how friends can join the program.
Oh, okay. Because I think currently what we had done is just to say the students that we had joining this initial cohort, this is a program that we'll continue doing. But for the meantime, we have said the ones that we have admitted into this program are the ones that we will work with for now in terms of the follow through and everything, so that if friends want to join, cross-learning, sharing experiencing is encouraged and very well. If you have a friend who wants to say attend a session, I would say there's no harm in your friend coming in. After all, we want to raise awareness. So if someone wants to join, say there's a webinar session going on a particular date, and there's a friend or fellow student who would want to join, please feel free to have them tag along and come in. But regarding now the follow through of, especially when it comes to submission of the projects and monitoring of who is doing what, I think the ones that were admitted into the program are the ones that will follow through for this phase. I don't know whether my fellow colleagues have anything to add on to that or any other insights. Maybe Daniel, or we also have colleagues from React Africa on the call. There's Dr. Tracy, and there's also my colleague Musonda Lamba joining in from Lusaka, Zambia. So feel free to jump in if you have got any insights on these questions that are being asked or any reflections. Yeah, the other question, Daniel, was on, is there,
it was on data resources, but I was was asked by Saddam, but I haven't really quite understood what he meant by data resources. Maybe Saddam, I can also see we have some students who have raised their hands. So please, Saddam, you may maybe retype the question. Let me check those who have raised their hands. We have.
Yeah, I think we can take 3 questions from the people who have. Yeah, anyway, there's let me start with Elisa. Is this, yeah.
Yeah.
Elisa has a question. Please go ahead.
Thank you so much. Good evening, everyone. My name is Ndiama Chalisa. Mine is just a concern about the results you showed. When you see the results for the first question, they are not balancing percentages. We are having 54, then others are 23, 29, and we do, when you sum up to get the 100%. So where did the disparity come from? And here, 23 plus 29, this one gives you about 52, then plus 54, this goes above 100. So I am here, there is a concern here on the first question there. Thank you.
Oh, okay. That's a good observation that I hadn't seen as well. Since this is auto-populated by Zoom, I don't know how, so 29 plus 54 plus 23, what is it giving us? What total do you get, Elisa?
You go to 56, I mean 106.
Oh, 106. So yes. What 106 is it's giving them. My suspicion is that, and then when you add 28 plus 52 and 22, because I'm just trying to think why Zoom would give us a percentage that's exceeding the total of 100. But it's good and a great observation. It's good that we managed to get the principle of what we wanted, which is to see which session most students wanted, but a very great observation as to why it maybe exceeds the 100%. I don't know whether if we add 28, 52, and 22, what do we get? I'm just trying to think. I hope it comes out to the number of votes. But anyway, good observation there of why, and I don't have an answer as to why it's exceeding the 100, since it's something that auto-populates when it's calculating percentages. Yeah,
Julian,
I hope that answers you. Yes, Trace. Yes, Dr. Tracy, go ahead.
I'm just thinking, okay, it's a good observation, but just thinking from the top of my head, probably the people who chose more than one option. I don't know. Was that possible? Was it possible to choose more than one option?
I think
so. It could be that could be a reason, but I think also it's not something to worry people too much, because it's just to give us an inclination of what the majority preference was. Over.
Yeah, thank you so much. Yeah, that is good. And as she said, it's true that it has been helpful in what we wanted to establish. So I don't know if there's no other question from Elisha. Let me go to Esther. Esther, you can go ahead. I've unmuted your mic. Hi, Esther.
Hi.
Yes, please go ahead and ask your question. I can hardly hear you. Try and move closer to your device or increase the volume. Esther. Okay, Magino has a question. And it's good to see that quite a number of students have actually joined in Slack. I'm seeing notifications here. Do we have any other questions in the chat, Daniel, before I give opportunity to Edna?
Yeah, please, I think they're just general concerns. I think because we have people who have been able to join the WhatsApp group and the Slack channel, maybe if you have a challenge from your end, I think it's maybe you can check your device, please. And also, yeah, we will share the recording via Slack channel. As we said, we'll use all communication will be done via Slack. So we'll share the recording for the session via the general channel for the Slack platform. Yeah, and also those asking about maybe having a friend join the program, Julian shared. For now, the program is fenced to those who are selected. However, if we have a session, because we'll be having sessions, and you have a friend who wants maybe to attend the webinar, you can always invite them over. But for evaluation and for certificates and also for the project, we'll just involve the students who are selected for the program. Maybe, I hope that's clear. Maybe, Julian, maybe we just have concerns. So I will reshare the Slack link and the WhatsApp link via the chat just now. So maybe if you aren't able to join by the first time I shared, you can try joining once more. Yeah, so as you have shared, communication will be done, we'll do the communication via the Slack. So any resources, any links, we'll share them via the Slack for easier retrieval and referencing. But for WhatsApp, we'll just share general communications. Also in your groups, maybe you can also discuss via WhatsApp for the tasks that we'll have. There's someone asking if the program will be entirely online or we shall have one point of meeting physically. Maybe let me answer that, but Julian, you can also expand on the same. So generally, because we are all from different countries, the program will be virtual for now. Yeah, but maybe in the future we could have maybe more of a physical, and also due to the pandemic too. it's not really good to have the physical sessions. So maybe Julian, you can expound on that, please, on the mode of the program.
Yes, thanks, Daniel. Yes, that's true. This will be virtual 100% now. But the intention is, as we, once we have started this, one of the suggestions that was there is maybe if COVID-19, of course, allows, because that's another key challenge we have to face in these current times, wouldn't mind having a session where if we get some sponsorship, we can have students coming into one location, even from different countries, to at least come for a further capacity building platform or share the work that they have been doing, etc. So it's something that can happen in the pipeline. Maybe even from the graduates from this program can then be invited into a session that can be physical if the COVID-19 allows. But currently for this 5-month one, definitely 100% virtual. And I think, so at this juncture, I think I'll just take one question. There's Sheila who's raising a hand, and I think this will be the final one. If there's any other concern, then maybe we can touch base as we continue the communication on WhatsApp and also the Slack channel, because we are now past the time that we're supposed to end the session. So, Sheila?
Okay, thank you very much for giving me this opportunity. Personally, I'm committed to attending this course, but bearing in mind that the course will be entirely online, I anticipate like to face some data challenges at times. I don't know whether you have a way of catering for such a challenge at times.
All right. Yeah, thank you so much. And that's such a great question, Sheila. Which country are you joining us from?
I'm joining from Uganda.
From Uganda. And currently, are you attending school or are you on like, which program are you doing?
I'm doing nursing.
Nursing, all right. And currently, are you doing physical or virtual classes? I just want to understand, so, sorry.
We are doing online, but
okay.
At times I face data challenges. So I was
all
just
right. Okay.
Yeah, that is
because
no, that is it.
Yeah. So I totally understand that in our setting, sometimes connectivity is an issue, joining online is an issue. But as I said in the beginning of the presentation, that when we did our SWOT analysis, one of the opportunities we saw was that since now the COVID-19 pandemic has led to more students doing virtual classes anyway. So in terms of attending, to start with the devices, which is something that some students did not even have because lessons were mostly physical. But then looking at the opportunity that most students are doing their mainstream academic program using devices, joining in via internet, we found that it will be at least easier for them to join. But for some reason, so my assumption, anyway, where I'm getting to is my assumption is most students, since are already doing online classes, this will not be so different in terms of the modalities of logging in. Yeah, that would be my response. But in the event that you face any other challenge that maybe you feel we might need to address, reach out. But if it's common logging in and stuff, I'm sure most of us will be able to do that. Yeah, so I don't know whether I've got, whether there are any, from myself, I think I don't have anything else, just to say, wishing you well. And as I mentioned, to reiterate that this is participatory, feel free to comment and say what you feel as we go along. And if you don't understand anything, feel free to reach out, or if you think you've got a suggestion to improve something, also feel free to do so. So I'll ask my colleagues if they have anything to say. Maybe I can give Dr. Tracy, do you have anything to say? Or any concluding remarks?
Sorry, I was on mute and I did not realize. Not much, just to re-emphasize that students are definitely an important stakeholder in the AMR agenda, not only locally, but globally. And it is only through the role that we play as students. And this program is key because after this program, then you become a student leader of AMR. And what we usually call the training of trainers in our sector. But the important thing is that as the student leader or student champion or trainer of trainers, then you're able to also pay it forward by actively engaging other students and even other non-students, whether it's in research or other just innovative solutions. So I honestly wish you the best, and we really hope to interact further as you carry on in the program. Thank you, and thank you for your patience and listening to me. Over.
Thank you so much, Dr. Tracy. Daniel?
Thank you, Julian. Thank you to Dr. Tracy. I would love to thank all the students who attended the session for really creating time and getting to, attend the launching and also being patient enough. I can see you're now at 85 to this very moment. I know it's quite now close to 3 hours. We really appreciate that. Yeah, so mine is just to say there's a lot that we have in store for you. As Julian shared, all we require is you avail yourself and you be ready to engage with others, you be ready to learn, and also be ready to practice what you've learned. Yeah, and it's a hope that by the end of this program, at least as Dr. Tracy has shared, we'll have some AMR leaders, AMR student leaders, who are well, who have the capacity of, initiating different AMR interventions. And nothing much, let's keep the communication flowing. We'll be sharing updates by the Slack channel. So please be checking your Slack channels once in a while. Maybe you can have the notification bar on, because I'm sure it's more of another, not so more of a communicating app. So maybe we might forget some time to really go through the, maybe look at the app, and maybe we have some communication that maybe has been shared. And we'll also be maybe operating based on the particular month. So right now, you should be keen on looking at maybe if it's for now, be keen on looking at the AMR short course link and also the general link. Yeah, so I'm sure it may be a bit challenging at the moment, but you'll get used to it with time. I can see we have some people who are requesting to have the Slack link sent to WhatsApp group. Yeah, we'll send the Slack link to the WhatsApp group. For those requesting, maybe we have the recording sent to WhatsApp. Yeah, for now, for starters, we can have it sent to WhatsApp. But in future sessions, in case of any recordings, in case of any resources, we'll share them via the Slack channel. So please take your time, watch some tutorials and learn how to navigate the app. And I'm sure some of us who have engaged before, and I'm sure with time we'll get to know each other and get to know how we can engage more. So nothing much from my end. I just wish you the very best. And we hope that you'll enjoy the program. Thank you.
Right, thank you, Daniel. Most concerns on the chat are about sharing the links. That will be done, so don't worry about that. And Sheila, how do we say thank you in Uganda language?
In Uganda, we have so many languages. I don't know which language.
So the main one, how would you say thank you if you are speaking the most common language in Uganda, the vernacular? What would you say?
I think it's Uganda, but I'm not familiar with it. Maybe I can tell in my language.
So you don't know, Tweyanziza. Thank you. Okay, thank you so much.
You say webale munonga.
Thank you so much. And thanks for the patience. Thanks for this, attending this, and wishing you all the best. Thank you. So bye.
Bye-bye.
Bye.